Greetings, compadres. This is a great episode. I'm pumped for it. I just finished it, so now I'm going back to give the bio of my guest at the beginning. So that's kind of what is happening, which is kind of fun to do because, you're just sort of fresh from the entire episode, and it was really enlightening. So I just want to say, before I read Suleman's entire bio, which by the way is pretty amazing, so strap in, but I just want to say, hey, no big deal if you have ADHD already and you know that, you understand what it's like to be on the other side of that bridge. If you think you might have any kind of mental health disorder, if you think something could be wrong, but you don't know what it is, and you just want a little bit of support going through that process, I would say do it. Just make an appointment with a psychiatrist, get tested, figure out what's going on, because really knowing is that's the first step, right? And then you gain tools and you learn how to use those tools. And so I just want to throw that shameless plug out there. Yay, psychiatry. Okay, so here we go. Here's who I have on today, you guys. This was just so fun. Okay, it is Dr. Suleman Aziz Mirza, MD. He is also known as the Kicks Shrink, and he is a triple board certified physician in adult psychiatry, child and adolescent psychiatry, and addiction medicine. He works with the largest healthcare system in Northern Virginia as the staff psychiatrist for an adolescent partial hospitalization program. And he sees children and adolescents as outpatients there as well. He also has his own private practice, Lau Cow Psych, where he sees adult outpatients with a focus on ADHD, autism, and substance use issues. So in addition to his clinical work, Dr. Mirza has a growing social media presence with a following of over 85,000 across TikTok, Instagram, Twitter, and he has a YouTube channel with an accompanying podcast. How does he find the time? I don't know. Okay, so that's where he created edutainment videos. Get it? Educational and entertainment, right? Combined. Okay, so that's kind of what he does. He makes videos and content with the goal of breaking down mental health stigma, combating mental health, blah. Okay, scratch that, edit, please. We will start at mental health stigma. Breaking down mental health stigma, combating mental health misinformation, rehabilitating the often negative image of psychiatry and psychiatrists, interviewing leaders in the field, all while hoping to make his viewers laugh and learn something about mental health, but also his love for sneakers. Dr. Mirza has been featured in Time Magazine, The Huffington Post, The Daily Beast, BuzzFeed News, The Washington Post, Insider, Medical News Today, and he has appeared as an expert guest on NBC. He has also given numerous talks to the community locally and throughout the country on various mental health and addiction topics, as well as appeared on a number of podcasts as a guest, along with hosting his own. This is a great episode. I hope you will enjoy.
Welcome to Amy Liz Harrison's podcast, Eternally Amy, a mum of 8's journey from jail to joy. A Gen Xer who overcame her struggle with alcohol to become a best-selling author and mental health advocate. She shares stories of hope and offers ideas for others struggling with mental health challenges. One thing is for sure, you'll leave with something to chew on. And now, here's your host, Amy Liz Harrison.
Greetings, compadres. So, I don't ever want to discredit anybody's experience, right? We have lots of guests on Eternally Amy who share their personal experience, which is invaluable. And basically, without that authenticity, I probably wouldn't be here. That's how I got started on my journey, was just laying it all out there. But it's really neat to actually have a guest on who has professional wisdom to share with us. And not that anybody who doesn't is not professional, but it's just nice. It's nice to have somebody come on and spend time with us and share their expertise. So with that, I am so grateful for this opportunity. And I would like to say welcome to Dr. Suleman.
Thank you, Amy. Thank you for having me on.
Yeah, thank you so much. Now, before I get started asking you questions, I have to say, when I got your headshot and I was looking at it, I was like, all right, I got to hear this story on this one, because it's this great picture and it just immediately made me smile. And I was at the dentist's office, but it's this great picture of you and you've got like this Nike shoe phone is almost what it looks like up against your ear. And I was like, okay, something is going on here with basketball or with Get Smart, that old show from the 60s, something's happening. So I need to ask you about that first and foremost.
Yeah, so I've kind of developed this online persona called the Kicks Shrink, right? That's my plugging my socials a little bit now. That's how you can find me on there. But I've always been like a basketball fan, a sneakerhead in some way, shape, or form, going back to my childhood. But my parents were Pakistani immigrants. They were like, we're not going to buy you these stupid sneakers. So I'd always like go, my parents would rather spend their money on sending me to private school and all that other stuff instead, which, in retrospect was probably a good thing. But while all my friends were having Jordans and all the latest designer sneakers, I was having like the LA Gears and like the knockoff Payless shoes to wear. So when I became like a doctor, I fulfilled my childhood desires and started buying like all these sneakers. And now I have like well over 100 pairs of sneakers. I have a wall in my house is like just cases of like sneakers and stuff. So that became like a little bit of my persona. And so I've always kind of brought that into like my work to an extent to be, I'm a psychiatrist and people have this image, this idea of like a psychiatrist as being a stuffy old white guy who like sits on the couch and like has smokes a pipe and talks about people's mothers and, all this other stuff. And I was like, when I'm working with my patients and they'd be like, oh, you're like a normal human being. I can talk to you about stuff. And I'd be like, yeah, of course. And, I have patients who like, we get on and we talk about like sports and all that other stuff. And I was like, oh, by the way, you doing okay? And it's like, yeah, we're doing fine. And like, that's what I wanted to kind of like really bring to be like, I'm a psychiatrist. I'm trying to be online. I'm trying to change the narrative of what people think of when we talk about like doctors and psychiatry and et cetera, et cetera, et cetera. So that's where it was.
I love it. And I promise not to get us too sidetracked, but I have to just say on the knockoff shoe thing, Payless shoes. I am a graduate also of Payless shoes. And they used to have a brand and one of their knockoff brands was called Champion. Okay.
Yeah.
And that was kind of like if you, weren't affording the really fancy shoes, that's kind of what you wore, at least at my school growing up in California.
Yeah.
And a few years ago, my kids came home and they were like, yeah, we want these Champion sweatshirts and all this. And I looked at the logo and I was like, that's the Champion from Payless shoes. What?
Yeah.
And I was so confused.
No, they had a massive kind of glow up in the last couple of years. They started collaborating with a bunch of like really higher end brands. Like I'm a big, I like Todd Snyder is a big, huge designer and based out of New York City. They did a collaboration with like Champion. The sweatshirts were like $200-300, and like it was ridiculous. And I was used to like going to the Champion outlet in upstate New York and like buying, you buy like 24 packs of socks for like $5, right?
Yes.
Yeah.
Oh my word. I'm so glad we had this part of this conversation,
Yeah.
because it's just nice to know I wasn't imagining it. Like,
No. Yep.
yeah.
Oh
Yeah.
yeah.
Oh my word. Okay. So, well, first and foremost, so you work with people with addiction issues.
Yep.
And what I thought, the reason I was so intrigued by you is that, you don't often find people who work with patients who it's like have the addictive stuff going on and have had a later stage in life diagnosis of ADHD like I did.
Yeah.
And now that I personally know of how that feels, and can look back and sort of see how both of those things were kind of braided together throughout the course of my life. I'm just wondering, I just can't forget to ask you, do you find a lot of times that people will have one and also have elements of the other, or is it not necessarily like that?
One of the things that I see is, well, when we're working with like addictions, substance use disorders, or anything along those lines, one of the questions I get a lot of times is like, why did this happen, or how did this start? And a lot of times people will say things. One of the old way of dealing with them was like to just stop drinking, or to just stop smoking, and it's that simple. And it's like, no, of course not. It's not that simple. Or else, this would be an easy thing, and nobody would be dying anymore. Like we're having record-setting overdose and alcohol and substance-related deaths, year after year. Again, this is America's leading the way in this. And the reality is, like, when I started to do a lot more practice and seeing people over years, even like during medical, after finishing medical training and, living in one place, being there, you see this trajectory in people's lives, right? That like ADHD was kind of there. It was never really addressed, or it was like purposely not addressed. That's another kind of thing that we see, especially with young parent or young people, and then their parents are like, we don't believe in ADHD. And and then they're like, we're not going to put them on medications, or we're not going to like do treatment because we think this is all BS.
Right.
And what happens is those people will be suffering in some way, shape, or form, right? Whether it is, the prototypical like attention stuff or focus stuff, school things, or they're hyperactive or whatever it may be. And they will seek out the treatments on their own. And the treatments on their own are different forms, right? And what we see, like most commonly, the most common thing that people with untreated ADHD go to first and foremost is nicotine, and then alcohol, and then cannabis, right? It's not like all of a sudden they start jumping straight to like cocaine or like Molly, or like they're buying Adderalls off the street. Like people, again, who aren't in the know will say these kind of ignorant kind of comments. It's like, no, it's a lot of times it's access, right? And we know nicotine, alcohol, and cannabis are the most commonly accessible things. So, and then and what will they say? They'll say things like, "Oh, this smoking, back in our days, right? Like cigarettes were the common thing. Now we've kind of done such a good job with the campaign against smoking that people aren't smoking cigarettes as much. But now we're vaping. That's a whole different topic. But like we know that nicotine does the job of a stimulant in a way, right? Of a stimulant medication, which we use commonly for ADHD. Like it helps slows the mind down. It helps us with our focus. It does that. So they're like, oh, this is good, right? And then we know the problems, however, with nicotine is that it is so addictive. It is that feedback loop that's so powerful, and that short half-life. It kind of gets out of your system so quickly. So you need to have another cigarette or hit the nicotine again really quickly after you use it, because it doesn't last 10 hours or 5 hours or an hour even, right? It lasts just for a little bit of time. So that's how that kind of develops and goes from there. So many times, like people will say, like, where did this come from? It's like, it it came from this, right? It came from not treating the ADHD, and people then having to seek out their own treatment in its own way. And a lot of times when I work with people and we kind of do a thorough history where we're like, you probably had ADHD when you're younger, and then we treat it, right? Whether it's medication or therapy or whatever, the addiction stuff kind of goes away a bit. People will commonly say, they're like, oh, I don't feel like I need to have a drink. I don't feel like I don't need to smoke as much or whatever else it can be.
That totally resonates with me so much.
Yeah.
I think that, for me, just hearing you share that reminds me of my self-esteem issues that I had growing up and, being a neurodivergent learner, but not knowing what that was.
Yeah.
And not knowing that that was okay. And of course, not having access to, nobody was really doing that back then. So,
Yeah.
you sort of were in the pack, in the herd with your fellow students. And for me, just watching everybody else grab those math concepts, easily. And I'm just sitting there going, gosh, I'm dumb. Like something's wrong with me. And then carrying that through my entire education, through college graduation, and just kind of feeling like I barely scraped by, right? And then having that feeling of like, man, now I'm in the workplace. Everybody's able to get all of this stuff done quickly, easily. They've got a system. My desk is super messy, but I know where everything is, but it's just piles. And just feeling like all of those things made me like less of a person.
Yep.
And then when I started drinking alcoholically, it was like, or overly using alcohol to treat how I felt inside, thinking that that was going to change my circumstances outwardly. That was just a huge, I just thought, well, yeah, I deserve to feel good like this because I never feel good like this. And so I had all these rationalizations.
Yeah.
Yeah.
Yeah, it's something we see, especially with like, there's absolutely totally like a gender bias in medicine that occurs where, a lot of the times when we think of ADHD, when a lot of people think of ADHD, they're like, oh, they're little boys that are running off the walls, and especially like, again, we can throw a little racism in medicine in there too. They're like little black boys who are annoying and jumping off the walls. So white girls typically don't get on their radar for people who are looking for it. And what happens is exactly what you described is they don't get caught with it in regards to like nobody really thinks of ADHD as a thing. And then all of a sudden they're not doing well in school or they're zoning out and they're, again, Clueless came out when I was like, in my teenagerish year or almost teenagerish years, I think. And everyone was clueless, right? Everyone was this blonde ditzy girls, right? Or they're dumb, or girls aren't supposed to be good at math. Girls aren't supposed to be doing all the things that people say. And then it kind of feeds into it, or then even kind of like when we get to those transition stages from like high school to college to graduate school or the work world, where like there's a glass ceiling that comes into play. Again, that's also there from kind of the aspect of you're not doing as well as you could because you have this undiagnosed condition that's there that's kind of holding you back. And again, it feeds into these gender stereotypes of like girls aren't supposed to become CEOs. They're not supposed to become doctors. They're not supposed to become these higher achieving, quote unquote, higher achieving positions because they're meant to just do staying at home and being a mom and blah, 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 blah. That's there. And again, I totally right. It feeds into like self-esteem. And then it sends them down this path of like anxiety, depression, and then being, and then they're like, oh, well, you're depressed. Clearly you're depressed. Go see a psychiatrist or go see your doctor. And they'll be like, well, let's put you on antidepressant medication. And the medication doesn't work. And there's side effects and there's all the other stuff. And it just creates this like endless terrible loop. And, unfortunately we deal with this on our end where we're like, there's a lot of kind of like anti-psychiatry discussions and movements and horror stories, frankly, right? Of like, I've had decades of abuse in the system. And it's like, yeah, because people didn't see what was going on or they had their own biases, then unfortunately it played out that way.
Yeah. So basically you just kind of foretold exactly what I went through with all of that. And, it's interesting being a parent, right? Because then I watch my own kids. I've heard from my psychiatrist, his opinion is that, ADHD will run in family lines, or can.
Yeah.
And so even having teenagers and trying to keep that discussion open of, I know I'm your mom and I obviously have your best interest at heart, but I want you to know that there is no shame in if you're having trouble and you need more time in school, or B, if you're feeling like something isn't quite right and you need some help sorting it through, like, I'm your helper. I'm here to get you that assistance that you might need. I'm not going to try and fix it or help you through that per se.
Yeah.
I'm going to support you, but I know where my skill set lies and also kind of where my place is as a parent. And so, yeah, a couple of my kids have been in the chair and have been diagnosed. And I try and tell them, gosh, it was my experience that's very empowering once you're diagnosed, because it's like, oh, okay, that makes sense.
Yeah.
Things start falling into place, and the puzzle pieces start coming together, and you can sort of look back and just go, okay, yeah, and sort of see that whole thing kind of come full circle.
Yeah. Yeah. I think we see this a lot of, when I'm working with adults, we see this kind of like late realization, or they, we kind of have this discussion. They're like, something's wrong, something is off. Again, I've tried dozens of medications, nothing worked. And then the first time you bring up ADHD, they're like, what are you talking about? And then you run through all the symptoms and they're like, oh, wait, that's me. That describes me. And then you're like, well, let's try this medication. Let's try something different. We'll try like appropriately treating it. And they come back the next day, or not the next day, whatever, the next time we have their appointment, or they'll message me and they'll be like, I'm in tears because the first time in my life I felt clarity of my mind, or the first time my mind was like quiet and I was able to like start a task and do the things I need to do. And they're like, where was this for the past 30 years of my life, 40 years of my life, etc., whatever it was. So what my life could have been. And I think that's one of the things I always kind of tell people is like, watch out for that, like that regret kind of moment of regret that occurs, where like, my life could have been this if only this was here however many years ago.
That's so important. And when people face that moment, what are some ways that they can deal with that?
It's hard because, I think one of the hardest things in life, just in general, is like regret and thinking back on things that we could have done different. And, we can use the old kind of sayings that are there, like hindsight's 2020, and we can't go back and change things back then. But like the idea is that, hopefully we still have life that's worth living going forward, and we can change those things and then make those changes however it needs to be going forward. And then kind of like what you're describing before, like if we have kids or family members and we start to notice signs that are there or things to watch out for, to kind of be like, let's try to make people aware and say, like, see if we can make a difference from that point of view.
Yeah. And what are some, I don't want to call them red flags, but maybe some signs that a parent could look for in a child, versus typical teenage kind of behavior?
Yeah.
Or you might want to suggest to your child, or just bring them in for an evaluation.
Yeah, I think the biggest thing is like, don't always get stuck on grades, because so many times people, and that's one of the more common things that I hear a lot, is they're like, well, their grades are fine. They can't possibly have ADHD because they're doing well in school. It's like, no, that doesn't, grades don't mean anything for the most part. But what I kind of say to people is, watch out for if the kiddo is struggling, if they're noticing, they're like, hey, I don't get these things, or there's concepts that are not kind of being picked up when they should be being picked up. if you're seeing like an increase in like risky-ish kind of behaviors, right? Or impulsive kind of behaviors, there is that aspect where it's like, okay, there's normal teenage stuff, right? That's totally allowable. And that's totally normal. That's to be expected. And we get concerned when we don't have normal teenage explorations and normal teenage kind of like, mess ups that are there. That's part of the learning process. But like if it's something that's like, okay, they're not learning the lessons, right? They're not learning the lessons that they're supposed to. And they keep doing the same thing over and over again. Or teachers are starting to kind of give feedback, or other adults are kind of giving feedback that like something ain't right. That's when you want to start to be like, hey, sit down and discuss and be like, are you noticing some struggles? Are you noticing some problems? Is there something that's bothering you that we can help you with? That's when you want to kind of get that help.
Mm-hmm. I think too, it's interesting thinking about back in the day, things like Ritalin. And I mean, you'd hear somebody and this is like when my older set of kids who are adults now were little. So not when I was a kid, but when it was just kind of starting to be sort of talked about in terms of if a kid was, quote, medicated, unquote, it was usually like, oh, Ritalin, and it had like this bad rap. And I think one important thing that I learned was like, gosh, there's so many different options. First of all, today, medication wise, but also, all these tools and medication being one of those tools, right? To have all of these tools in our toolboxes and at our disposal, like I feel lucky, I kind of feel like in a way, even though I was diagnosed later in life, and I too was thinking that, oh, this is postpartum depression. I had all these babies in this short amount of time. This is definitely what it is. It's like that was totally secondary.
Yeah.
Yeah. So I think for me, once I was diagnosed and actually did do as my doctor suggested, which was get tested, go through that process and find out, yes, lo and behold, you're like off the charts, Amy. It was sort of like once I accepted that, it was great, because, not to say I don't have like days where I'm like, man, I just wish I could sit down, stay focused on one thing and get her done. And like, but it is just, I've seen the superpower side of it, right?
Yeah,
I've seen the benefits of it. Whereas before I just was constantly like, I'm spinning, I'm in the middle of it. Yeah. And
it's definitely like, again, like very similarly, like I'm a later diagnosis in life kind of ADHD. Like this was after I had like, failed out of dental school initially, right? And gone into medical school, and I finished my psychiatry training and residency. And then I was like diagnosed with ADHD. So even like, me going through the whole process and seeing and doing, hundreds, thousands of evaluations, at some point in time, like, and again, I think part of it too is this, the bias that's in there, like even within the medical field itself of like adults don't have ADHD, they get over it, and then kind of like, again, when I started doing evaluations in my clinic, and I was like, oh wait, this is me. All these people that are coming to me, I was like, this is what's going on in my life. Like, again, to share a little bit, like, I failed out of dental school, right? Initially I was going to be a dentist, like, and a lot of it was due to just like not planning and thinking that like what I could do before, like, I always kind of say like, everyone has like their natural smarts, right? Or some natural kind of ability. And I was, blessed to be a pretty smart person. I didn't have to study a whole lot of times. And when there was stuff, like even in college, I could, just pull an all-nighter and you're good to go. And like, you still get like a good enough grades and stuff. But everybody has some level where it tops out, where that doesn't work anymore. And for me, it was like, graduate school. And, when I was like, oh, I'll just, cram gross anatomy the night before, and I get like my first test and it's like a 40. I was like, what? I was like, what is this? And then for other things, like even just organization in general going forward, I'd always be like, oh, I'm going to play my video games when I come home from school first. And then next thing you know, it's like 9 o'clock at night and they're like, oh, I need to study. I was like, no, but I also need to sleep. So that's what kind of happened. And, ultimately that didn't work out. And then, I had a little kick in the butt and had to like come back home for a bit and then go off to the Caribbean and do doctor college from there. But I came back and even in training, there were other kind of difficulties and stuff that popped up. We're dealing with like student loan stuff. And, when you're a student still, like in the student loans, like you can just defer them, right? You can just you fill out the form every year and you get it signed off by the person and your loans are deferred and it's no big deal. And you'll deal with it when you have to, when you get money, right? I didn't fill out the forms. I was like, oh, this forms? No, I'm not. Yeah, I'll do it. Whatever. I'll get around to do it, and never did it. Right.
Yeah.
So, that has its impact when you don't pay your loans back when you're supposed to, or you don't fill out the forms when you're supposed to. So when I graduated, like my residency and my fellowship, and all those years later, my credit score was like 500 something. Right. And that's one of like those real life impacts of like ADHD. And then like my wife were like, oh, we're trying to buy a house. And then someone pulls a credit. They're like, your credit score is 500. What's going on? I was like, what are you talking about? So again, there's the real life ways that this shows up that we don't, stereotypically going to think about. So.
Yeah. Yeah. So true. When you were talking about the forms, I was thinking about even when I filled out some of the forms to get tested for ADHD, that took me forever. It was like as if I had an inability to actually complete the forms, right?
Yeah.
I mean, have you seen that before? Yes, I hope.
Yeah. Oh yeah. There's definitely that aspect of like, I think you were describing to like the piles in your system and stuff that you have. Like everyone has like their system. Everyone with ADHD has like their system that they have, which looks from the outside as like super chaotic and a mess and a disaster. How could anybody live like this? But if you mess with it, like it works for you, it works for me, right? Like we all have our thing that's there. But again, there's a lot of people with ADHD will have that like to-do pile, but it needs to be right there in front of their face to do it. And if you put it to the side, right, if you don't write on the bills envelope that it's bills and it needs to be paid by this day, and you don't have that right in front of you, it's out of mind, out of sight, out of mind. That's what occurs to it. Auto pay is a godsend because you're like, anytime you open up any kind of like, card or whatever it is nowadays, you're like, first thing, where's the auto pay? Because I know that I won't have to, I know that I won't pay it otherwise. And then it'll be like, it's not that I don't have the money or I can't pay it, just forget to.
Yes. And I think too, I've been so afraid of judgment along life's way too. Somebody comes over and I'm always like apologizing, like, oh, sorry, this pile of Amazon boxes are sitting here, it's perpetually growing every day. And I just get so afraid of that. And I think that one of those things that does challenge me is to, if I'm not going to change anything else at this moment, like, okay, change the inner dialogue of how I'm talking to myself about this, or presuming that somebody else is thinking something else about my Amazon boxes. And I'm probably giving it way too much weight and value. They probably don't care at all. Not, they're like, wait, what? Which is usually what happens is people are just kind of like, I don't care.
Yeah, it doesn't matter.
Yeah. But I think there is such an interesting, sort of stigma about some of the systems, as you mentioned. I love that word because, it's like, hey, if it works for you, it works for you. Occasionally I'll see a vehicle parked. This is a yet for me. I haven't done this one quite yet, but so I'm not judging it, but like a vehicle that has a dashboard full of trash and, McDonald's like cups and books and, and I think to myself, wow, like that seems like an interesting person to meet because that is, sort of maybe working for them. Otherwise it wouldn't probably
like, what is this?
get some help in trying to clean that up. But I think that there is such value as we learn more about each other's cultures, backgrounds, genders, experiences, and just going, okay, so here's yet another thing that we get to work on accepting in ourselves.
Yeah. No, for sure.
where we differ. Yeah.
Yep. No.
Go ahead.
No,
Sorry.
no, go ahead.
I was just going to ask too. I was thinking about other parents I know who are in recovery programs.
Mhm.
And a lot of times they will think, gosh, like I'm sober and clean now, but maybe back in the day, my using affected my kids. Is that going to cause them mental health issues today? Where do all of these mental health issues come from? And what are your thoughts on that? And how do people kind of deal with some of those old threads?
Yeah, there's always people who are going to be, there's a lot of like the pop psychologists, the Instagram psychologists and stuff will say things like everything is trauma. It's all comes from trauma. And, like if like your elder sibling looked at you one day the wrong way when you were 3 years old, and it was interpreted as a trauma. And now this is why you have ADHD and this is why you're like, using substances. It's like, no, it's like relax, right? There's that aspect of it where it's like not everything is trauma. Does trauma have a role in stuff? Absolutely, sure. It plays a role for sure, that it does have its impacts. So we know that like one of the things that multiple things, right? When we talk about like development and the development of like mental health issues and struggles, one of the main predictors was something called like ACEs, or adverse childhood experiences. I'm not sure if you're familiar with that at all, or probably, right? A lot of people are familiar with it. It's so kind of like a quick rundown. Is like Kaiser and like the government did like this study back in like the 90s where they looked at like all of Kaiser's like hundreds of thousands of patients, and they had them do this questionnaire, and they kind of narrowed it down to like a 10 bad stuff that happens in somebody's potential like growing up. There are things like a victim of abuse, whether physical abuse, sexual abuse, or like a parents were divorced, or you witnessed like your mom being abused, or a parent went to prison, or there's all these other, or you were again, like there's a lot of these 10 kind of checklist things, yes, no questions. And then based on that, how many yeses you had kind of was like a predictor of how your life was going to be. And this was, not, it was kind of like a fortune telling in a way. So they saw that like if you had like one positive answer, then you were going to have higher risk of certain things occurring, like mental health struggles or substance use, or like dying early, or unwanted pregnancies or early pregnancies, anything along those lines, right? And it was like 4+ is like your life is screwed. To put it bluntly, they're
No
like if you have,
pressure.
yeah,
Yeah.
no, they're like if you have these 4+, or if you have 4 or more of these things happen to you in your life before you turn 18, like good luck. Was like the long
Okay.
and short of it, right? And so what it allows us to do, right? Because, again, I'm not a big fan of like this, like, well, now good luck, and now you have this sentence, and now welcome to the system, and this is these just predict all these terrible things are going to happen to you. It gives us a roadmap to say, let's make sure that we're looking out for these things more so than not looking out for these things. Let's like be aware of the fact that like these people, these kids, who are growing up are going to be more prone to negative outcomes, or they're going to be more prone to substance use. They're going to be more prone to like potentially getting into not achieving as well in school and academics, and again, all these other stuff that happens. So let's watch out for them. Let's keep an eye out for them. And if we notice anything that's starting to slip a little bit, or we're starting to notice some behaviors that are potentially problematic, get that help earlier, right? Don't hesitate for it. So that's ultimately the way that I look at it. It's not this like, again, crystal ball fortune telling, we've got cards on the table and this is what's going to happen, but what do we watch out for?
Mm-hmm. Thank you for sharing that. Thank you so much.
Yeah.
Because I was thinking about, my older kids. So when I got back from rehab in 2011, I'm like starting off on this sobriety journey. I don't know which way is up. I can't even put my socks on. Like, early days, rough days.
Yeah.
And I was so happy to be home with my first 4 kids. And I kept saying, you guys, I think we should go to therapy. And I think that, we need to do some family sessions and blah, blah, blah. And my therapist at the time was like, you know what? I love that you're being proactive. Good job.
Yeah.
But at the same time, just let them live their lives, and if you see that they are maybe needing to talk to somebody or they might need some help, then have that conversation. But it's like
Yeah.
you're almost trying to create something that's not there, and I just thought that was so interesting.
Yeah, no, we see this sometimes where parents will sometimes like fortune tell for their kids, right?
Yeah.
And we see this a lot of times when people have like a diagnosis of bipolar disorder, like
Mm,
almost all the time. And again, bipolar disorder is one of those diagnoses I have like personal qualms with at times because it's overdiagnosed and
mm.
misdiagnosed a lot of the time. So again, there's gender stuff in there as well. Anybody and if a woman got angry at one point in time, she's been diagnosed with bipolar disorder, right? This is what happens in the
Yeah.
world, unfortunately. And then we see this as like when they have kids, they'll be like, "Oh, well, I have bipolar disorder now. They were angry at me, so now they have bipolar disorder, and so we should put them on these medications because this is what worked for me." And I was like, "Your child is 8 years old, ma'am. Like it's part of they're supposed to get angry at times. They're supposed to argue with you. They're supposed to do these things. It doesn't automatically make them bipolar." And
Yeah.
again, like it's that aspect where like we appreciate that you're trying to bring your understanding of genetics and watching out for stuff and awareness, and great, but it doesn't mean that everything is pathology.
I love that. I love that so much. Yeah. I think there's, a tendency, I think, for me especially to do that is like, oh gosh, well, it's because I have so many issues and I wonder if they're going to have issues and so it's like, you know what? How about Amy, you just deal with you. You deal with
Yeah.
you and you just love them and be a parent and then it kind of unfolds.
Yeah.
If one of them needs a little bit of assistance, you see it.
Yeah.
You start to see these things.
Yeah. And it's one of like the common kind of takeaways to like the simplifying of it all is when I tell people is like, it's not a problem until it's a problem, right? All these criteria and like the DSM, we can all check boxes and we can be like, oh my God, am I depressed? Or oh my God, am I anxious? Like, do I have clinical depression? I was like, unless it's a problem, it's not a problem.
It's so true. It's like reading the side effects on a
Yeah.
medication. It's like, oh my gosh, I think my throat is closing up. Like, what? It's like the power of suggestion sometimes, for me
Yeah.
anyway, where,
Yeah.
yeah,
Oh yeah. Yeah.
so
So
interesting.
and kind of like coming back, like I know you were mentioned before, like the ADHD is a superpower thing. Like, and again, it's one of those tropes that's like yes and no sometimes, right? There's some
Yeah.
qualities of it where it can be like so much of like superpower, but like we see again a lot of the people who are online who are saying negative things about it, like, oh, you don't need to like treat your ADHD, like the medication is a prison for you, and again the naysayers are out there. It's like,
Mhm.
and then you see what their life is like, well, they don't have a job, they don't have a relationship,
Mhm.
they've fallen into a lot of money for whatever reason, so they don't have the kind of um the constructs in place or the kind of the obstacles potentially that are in place that a lot of people, the average Tom, Dick, and Harry have to deal with. So for them, their ADHD can be great because they can be amazing content creators and put out all this stuff and do all this stuff on YouTube and become YouTube millionaires, and their life is conducive to that. The ADHD is conducive to that. It helps them out with those kind of things. But for everyone else who has to go to school and work a 9 to 5 for the most part, and then come home to kids or a spouse or partner, whatever it may be, and like do stuff, ADC is not always going to be that superpower.
Mhm.
That's where the problems come in.
Absolutely. Oh my gosh, right? Like, I mean, and even when you were talking about, or you're mentioning like in school, we were talking about systems and putting deadlines
Yeah.
down. And I mean, the thing about being a stay-at-home parent, for example, and again, I'm thinking back to my older 4 kids earlier days, it was like, well, if I don't get that done today, it'll get done tomorrow. I mean, just this endless kind of no deadlines thing, and just
Right.
really hard when I was given a deadline. and then another deadline, and then I'm reading school newspapers, and it's just coming at you from every direction, trying to figure out how to sort of live in both of those spaces. It's pretty challenging, at least for me.
It's challenging for a lot of people, right? And
Yeah.
that's part of what this is all about, is kind of being able to identify that like this isn't easy, right? And again, like the whole when we why a lot of the ADHD is missed in people is because again, this idea that we think of it as this like childhood school thing.
Yes.
And if kids are doing well in school, they can't have ADHD. And once you get out of school, then your ADHD is gone because it doesn't matter at that point. It's like, no, it interferes with every part of your life in any which way. And like those kind of assumptions that we make about like school and this is what it helped for, like that applies to real life as well. Like school is just practice for real life in a way, right?
Mm-hmm.
And it's foolish and almost like ludicrous to think that like, you know, once you grow up and become an adult and you're out of school, these problems just melt away and go away. And it's like, no, they show up differently.
Yeah, absolutely. Okay, so I got to ask you then about, I don't even know if this is a real thing or if this is just kind of urban legend, but I have heard people talk about rejection sensitivity disorder. Is that a whole actual disorder? Is that in conjunction with ADHD? Is that a buzzword? Is it a real thing?
It's a little bit of both.
Okay.
It's a little bit of a buzzword, right? So there's been a lot of, again, like a lot of the Instagram and pop psychology that's out there of like rejection sensitivity dysphoria. There's other things like pathological demand avoidance. A lot of these kind of like terms and classifications and descriptions of behaviors, you know, they're just a new kind of like what's it called? A fresh coat of paint on like these ideas that have always kind of been there. So, you know, again, like I've always looked at it, rejection sensitivity dysphoria as like a wishy-washy kind of thing, or kind of what we call like a softer symptom. So I'm not like a firm believer in it all the time.
So the dysphoria, because I said disorder, so then a dysphoria, that's different. Yeah.
So dysphoria would be more just kind of what's it called, like a sadness, a drop in mood that's related to versus a disorder, which is like something that's a process that's going wrong.
Got it. Right. Okay.
So, and I think the idea concept behind it of rejection sensitivity dysphoria is more so that like when we're rejected, or we feel rejected, or we feel neglected for some reason, then we become more so like heightened senses of sadness or depression symptoms that come along with feeling left out, when the reality is like that's not, you know, it's a kind of a cognitive distortion that occurs, or a misperception that's occurring.
That makes sense.
Yeah.
And then what would you say, like, you know, we all have so many different things that we're doing in our lives, right? Parents, working, different organizations that we might belong to, blah, blah, blah. What would you say is kind of your top recommendation for neurodivergent adults, right? Who are trying to sort of manage all of these things and carrying a cognitive load? What are some of the things that help people the most in that situation?
I would say that there's like one thing that like is most important over like everything else, and that's having support. Having a person that's there to kind of like keep you in check and to keep you accountable. You know, before, when I was talking about like, you know, my credit was ruined and all that stuff, it was my wife who was angry at me. You know, I was living my life blissfully. I was fine, right? But, you know, it's my wife and then the kids now, stuff that like keep me accountable a little bit. It's, you know, again, I'm in a position where I'm able to kind of have to have assistance, right? I need to have people who are doing stuff for me to help me out with stuff. So burgeoning up those supports as much as possible is like the biggest thing that I would say,
Mm,
because we know that people with ADHD, like they can't just do stuff on their own, right? Because that accountability to yourself is like whatever, it doesn't matter as much. You're able to kind of put that off and be fine with it and be like, oh well, next thing, okay, oh well, no big deal. But once there's an aspect of like, again, like, oh man, like I'm gonna get the power cut off in my home if I don't pay the bill, and my wife is going to be angry at me and she's going to like threaten to leave me, right? That's a thing, right? That's something that's a motivating force to be like, okay, make sure the auto pay is set up, right? And a lot of this is going to be like experiences that occur, right? Because like, the internet gets cut off because of that, right? Because I forgot to pay the bill, and that's happened in my life. I'm sure it's happened to other people too, right? Like, so like once we had these experiences, as much as we like complain, I complained to my wife about like, why are you bugging me about this? Why you keep reminding me about this stuff? I was like, I need it because I will forget, right? I will
right.
forget. So it's something that does happen. So if nothing else, like that other person, that other thing that's again keeping us on schedule, on task, whether it is again, a romantic partner or not, or whether it is like people at work who are going to be like, hey, make sure you get this thing done using checklists again that are right there in front of your face. You're checking those boxes, having it again a system that's there, whether it's to-do lists or stickies, whatever. That's what's really going to keep again this task-oriented model in place and keep things going.
I love that so much. Here's my
Yeah.
pile of stickies right here.
Yeah.
Um, yeah, that really makes me feel more normal. Thank you for that.
Yeah.
And yeah, I think some of the weird things that I do that help me out are just things that happen to help me. Like I'll
Yeah.
remember something in the middle of the night and I'll throw a shoe on the stairs. And it's a reminder, right, that I've got to go pick that thing up from the shoe place that's next to I mean,
Yeah.
strange associations like that.
Yeah.
But it works for me,
Whatever works, right? And that's what I say
right?
to people a lot of times. It's like when they come through and we offer suggestions and they're like, oh, what can I do? And I was like, well, I can give you a list of 10 things, right? And then if none of them work or you don't like whatever I chose for you, you're not going to do any of them. So that's what I tell them. I was like, you've got to pick the things that are going to work for you, right? And that's again, like sometimes my patients get frustrated with me when they're like, why don't you just tell me what to do? That maybe that's part of the whole ADHD aspect. They just want someone to tell them what to do, but it doesn't always work, right? Because
Right,
I'm not going to be with there 24/7. I'm not going to
right,
be like, well, Amy, don't forget to like, send that email,
right.
right? I might tell you like once, and then 3 months later, I'll be like, I'm going to forget to ask if you sent that email or not, right? But the idea is that like you need to have that person or that thing, whatever is there, to kind of again keep you correct, keep you on task. That's there. So that's what's necessary. And your system, whatever your system that works for you. Again, I may look at it, someone else may look at it and be like, what the hell's going on over here? But if it works for you and it works, that works.
I love it. I love it. Thank you so much. And on this same note, um, do you find that people like to, if you have ADHD, I mean, it's sort of like staying busy is kind of a tool that works
Yeah.
for some people a little bit better. Cause I know for me, if I have a day off, I'm sitting around either like sort of feeling guilty, like I should be doing something else. And then I'm in
Yeah.
that headspin, or I'm like, oh, I got nothing to do. And it's kind of like, then I'm just in this weird headspace where I'm not doing anything. Like, I'm like, oh gosh, maybe I should drink a glass of water. Like,
Yeah.
ridiculously off the range?
Yeah. No, I think that people in general are kind of task oriented to do something, right? And nobody is really designed to do nothing. Humans are not designed to do truly nothing. And when we do nothing, right, that's a problem, right? That's an issue. That's a lot of times it's like depression or anxiety getting in the way or other stuff that's there. So that's a thing that we also have to like remember is, we're kind of meant to be doing things. And
Mhm.
I think ADHD people are meant to be doing, or sometimes feel feel that they need to be doing more. And sometimes it happens and sometimes it doesn't happen. or things get half done. A lot of things get a little bit done, right?
Yes. Yes, absolutely. It's like the 80-20 rule or something. I can get 80% of a task done, but that 20% may never happen ever.
Yeah.
Yeah. Yeah. Well, okay. So, Suleman, first of all, this has been an enlightening conversation for me. I don't know how I can tell you how much better I feel, but I just feel better knowing that like nothing I said or asked you, you had never heard before. So
Yeah.
yay. But as we wrap up, I'm super interested. And of course, I saved like the hot topic for last, but it's not really a hot topic.
Yeah.
It's just another tool. It's another way of thinking. I just haven't had experience with this yet, but people are now doing, and I guess as far as I understand it, it's more for depression and past trauma and stuff, but they're doing ketamine treatments, they're doing mushroom treatments.
Yeah.
What are those tools? Is that what it's used for primarily, is depression, or does that extend into other areas? And should people who have had addictive tendencies be wary of such tools?
Yeah, so ketamine is something that's really popping up a bunch more, especially in the past, I'm gonna say 5-ish or so years. There was the approval that came out from the FDA for Spravato, which is like intranasal ketamine, a little spray for ketamine. We do that in my private practice over here. I think it's been fantastic for a lot of people who struggled with other depression options or antidepressants or other things like that. It can be extremely helpful for people. And the data and researchers out there, that's kind of showing mixed results as well. So some people it's really helpful for, some people it's not helpful for. Things like psilocybin, so magic mushrooms for depression or trauma as well, MDMA, which is more commonly known as like ecstasy or Molly. That's been used for like PTSD in war veterans. That's something, there's some research that's going on for. It's been going on for. So these things are out there. These psychedelics are out there as an option, and there's some very promising results and then some not so promising results. Mm-hmm. The main thing that I tell people is to kind of trust the process, because the way that things are being done, and people will quickly read like a CNN summary of an article or whatever else it is, and they'll be like, oh, cool, I'll just go buy shrooms online and I'll just take it on the weekend and I'll feel my depression will be better. And it's like, it's not that simple, right? There's a lot of stuff that gets lost in, this quick summaries or I read a headline scrolling through the news on my phone on the way to work, and what the actual practice is, right? Like with ketamine, like it's a very involved process. Like they're here sitting in my office for a couple hours and we're checking in with them, doing the blood pressures, and we have to report stuff. We have to send after every session, we have to send off a report to the government to like say, this is what happened. And these are the research and the data that came out of it. Things again, like psilocybin, like shrooms, like mushrooms and stuff, like there's a whole process for that. Like there's doses, there's therapy that's involved during those sessions. Like you have to be in a safe environment. Like, so is there promise for these things? Absolutely. And I think we have to kind of wait and see what is really going to come out of it and how it's going to be done, and understand that like you can't just do these things willy-nilly and hope that you're going to get a good result.
Thank you for that. And, I think that is such an important topic or thing that you said, basically to wrap up on. A key, I guess, is that, it's like, look, we've talked a lot about during this time, different things work for different people, right?
Yeah.
So it's like everybody's body chemistry is different, situation is different. And so I would say probably the best idea is always to work with a professional and to go to a psychiatrist to unpack some of these symptoms and be teachable, because I think some of us, myself included, as a 40 plus something person, we come up with oh, well, I'm finally going to go to the doctor and, here's my stack of things that I've read online, which is fine. But like, to be teachable is just so much better, to be open to what somebody else will see from the outside that I can't see because I'm in here, and to have those experiences working with a professional so that you can try different things that are, going to hopefully be beneficial and work to find what is going to make one's life more manageable. And there's not a one size fits all thing, right? I mean,
right. Or else it'd be very easy, right? My job, I would be obsolete if it was just a one size fits all thing. So,
right. Yeah. Oh, I am so excited about hearing all of this. Thank you so much, Suleman. And I got to tell you something, back to the shoes as we close. I just want to say that you are a champion. And I mean the good champion, not the Payless Shoe Source champion from our day, the today champion.
Yeah, the high-end version, hopefully.
The high-end version. So thank you so much for all the work that you're doing. And thank you so much for the time spent here today. I just really value it. And so I am grateful.
Thank you. Thank you for having me.
Absolutely. So for the rest of you listening or watching, just remember to be kind, rewind. Thank you for the honor of your time. Take what you like and leave the rest behind.
Thank you so much for listening to Eternally Amy, a mum of eight's journey from jail to joy. Amy Liz Harrison is a best-selling author, speaker, 12-step coach, meditation teacher, and recovery advocate. To find out more, please visit amylizharrison.com. You can keep up with Amy on all platforms by following @AmyLizHarrison. Please subscribe and review this podcast. It means so much to us if you do.